Hello everyone, welcome to Pediatrics and Neonatology. Today I will discuss nodding syndrome. Nodding syndrome is an epidemic progressive epilepsy encephalopathy syndrome. It is typified by atonic seizures and is a mentally and physically disabling disease. It affects children between 5 and 15 years of age, continuing into the adulthood. It occurs in geographically localized regions, including Uganda, Liberia, Tanzania, and the Democratic Republic of Congo, and also southern Sudan. The prevalence is approximately 6.8 per 1,000 children. Nodding episodes are characterized by at least daily rapid paroxysmal forward head bobbing spells lasting several minutes. Some patients are unresponsive, whereas others may respond to commands or continue what they were doing before the episode. Spells may be indicative of atonic seizures, although there may also be associated definable generalized tonic-clonic or absence seizures. The electroencephalography or EEG demonstrates a disorganized, slow background and interictal generalized 2.5 to 3.0 Hz spike and slow waves. Also, there are generalized electrodecrement and paraspinal electromyography dropout, and these are suggestive of atonic seizures. Nodding episodes may be triggered during meals, while eating hot foods, or drinking cold liquids. Cold environmental temperature may also trigger a nodding episode. Now, treatment of seizures is indicated. However, the response to the treatment is poor. As of 2024, no cure was known for the disease, so treatment has been directed at the symptoms and has included the use of anticonvulsants used to treat epilepsy, such as sodium valproate and phenobarbital. Anti-malarial drugs have also been administered to unknown effect. Nutritional deficiencies may also be present, which should be treated. Nodding syndrome is characterized by stunted brain growth, which include significant brain atrophy near the hippocampal and the glial matter of the brain, and the significant cerebellar involvement. Now, routine CSF analyses are usually negative, but brain MRI shows cerebral and cerebellar atrophy. An MRI study of Tanzanian nodding disease patient revealed that the most frequent abnormality was generalized atrophy. This was followed by intraparenchymal pathology such as changes in the hippocampus, gliotic lesions, and subcortical signal abnormalities. Now, epidemiologically, there is an association between intraparenchymal cerebral pathologies and skin infection with onchocerca volvulus. This nematode is carried by the black fly, the bites of which can cause onchocerciasis, a highly prevalent type of blindness which is caused by the infection. Onchocerciasis tends to have the highest prevalence in the rural East and Central African areas with poorly developed healthcare and social service infrastructures. Now, given the extent of brain pathogenesis in the nodding disease, it is not surprising that it is accompanied by lifelong profound cognitive neurodisability, severe behavior problems, and high mortality rates. The origin of these seizures is unknown. They typically arise in previously healthy children, although there may be a family history of seizures. Now, studies in Uganda support the hypothesis that nodding syndrome is an autoimmune epileptic disorder caused by molecular mimicry with the onchocerca volvulus antigens. Histologic postmortem examination of the brains has revealed polarized material in the majority of the specimen, but it has proved difficult to characterize or identify. Now, there is evidence of autoantibodies to leomodin 1 in the both sera and CSF of the patients with nodding syndrome because leomodin 1 antibodies cross-react with the onchocerca volvulus proteins. Nodding syndrome may be an autoimmune epilepsy initiated by the infection caused by this parasite. Therefore, it may be preventable by the treatment with anti-parasitic strategies such as the drug ivermectin. It may also perhaps be treatable in its early stages with immunomodulatory therapies. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health related videos.